The first thing is, what are the signs of anxiety? And so, one of the things, like I say to parents, is are you noticing that your child is not doing what other kids their age do? Sleeping in their own bed and they're 10 years old, let's say, um, answering questions in class when they're called on, going up and hanging out with friends or with even the cousins at the bar mitzvahs or the parties the family has. Do you find that your child is shrinking away from things, is avoiding things, is dropping out of activities that they used to do when you made them do them, but now that they're 14, it's like, I don't want to play baseball anymore. Why? And it's okay, some things change, but figure that out and ask, why don't you want to do these things? And of course, think about if they're staying sleeping in the room with you or have the lights on and such. So you've got to look at those kind of signals. You also have to learn to listen to what the teachers aren't saying. Oh, you're Johnny's mom. Yes. He's so quiet. I don't even know he's in my classroom. He's doing fine. All of his work's turned in. Whoa. Wait a minute. What do you mean you don't know my kid's in the classroom? And what does that mean? That means Johnny's not talking in class, isn't mixing it up. So we want to watch for those signs of avoidance, of dropping out of things. Are they crying? Are they upset? Are they clinging to you and getting you to do things for them? Are they not doing things that are age appropriate for them in terms of independent dealings? So those are some of the signs, okay? And kids will cry, kids will throw tantrums, kids, especially younger ones, to avoid things, they'll make excuses. I don't go to parties because everybody in my high school of 4,000 kids are on drugs and I'm not like that. It's like, oh, wait a minute. Maybe some are doing things, but not everybody. So you got to ask, what are the excuses for not doing things? Okay. And think about what's rational and realistic versus what may be exaggerated to get them out of something. And then the question what is normal? Again it depends on the age, it depends on where you live. What's your community like? What's your school like? Is it when I say are kids going out for pizza after school, but if it's not in a safe neighborhood or something, you always have to put things into context and think about that. What to do? Okay. This is the number one thing I'm going to let parents know. And it doesn't matter if the person is 7 or 70. If they have anxiety, they haven't learned how to soothe themselves. This is really and truly, and think about the friends you have who can't be alone. That if they are in a taxi, they're calling you. If they are in a grocery store line, it's like, forget it, I can't stay here, I'm leaving. They don't know what to do if they're home alone at night. That every TV and lights on and they're calling people nonstop. Well, it starts very young that you have to learn self-soothing. This is where parents should walk out of the bedroom before the child falls asleep and have things like teach them how to put themselves back to sleep. Do they need and want something soft and fuzzy? That's fine. But we want them to learn how to soothe themselves. So when they're upset and they call now on the phone and they're hyperventilating, it's like, breathe. When you start to breathe and you calm down, we'll talk. But don't try to convince them that they are going to be calm. They've got to work it themselves. So this is number one. I would teach them as parents. I teach my parents of kids how to do deep belly breathing and practice that with your child before they go to bed at night. And I have parents do it before you go to school in the morning. Deep, slow breaths that go slowly down your windpipe and blow up a balloon in your tummy. That's an inhale, and then exhale to let the the air out. Inhale, exhale. These belly breathing, deep breathing is a wonderful soother they could do anywhere, and people don't even know they're doing it. All right. Other tips. Let me ask you as parents to think about when you're doing something and you're messing up, what's your inner voice saying to you?
You're
And
an
just as
idiot.
it, yeah, what,
You
right?
screwed up.
Exactly. Now, if you were with someone observing someone and they were screwing up, how would you tell them that didn't work out and how to change it? Would you say, "You idiot, why did you do that?" No. So this is what I want you to think about is Your child needs to learn to have an inner voice to say, whoa, what's happening here? It's not going the way I want, or I'm afraid of this, but hold on. What can I do? Let me stay calm and let me examine this. That's a dog. It is barking, but it's behind that fence. I can keep walking by and it's going to be okay. And I could even go across the street, but I don't have to turn around and run home. You see, they've got to get a voice that coaches them to assess the situation quickly, stay calm, and say, how do I manage this? The teacher called on me. I don't have my work done. Oh my gosh, do I break out into tears and leave? No, I say, I'm sorry. Can I talk to you after class? Help them problem solve. So this is what we call the internal coach, recognizing what's happening, what's realistic to do, and then show that I can. We call these stick tasks. This is the other thing, get practice in dealing with the situations that are difficult for us. And like you said, we have to get kids into the situations, but not throwing them in the deep end of the pool. We break things down into a ladder of success, small steps all the way up to the big steps, let's say. And so that's the other thing. Give your child plenty of opportunity to practice doing the things they're afraid to do again and again, and getting more and more complicated as you move along. Now, if they can't do this on their own, there's always cognitive behavioral therapy, and we're always here to help, and we're all over the place to try and find people who do CBT. But that also, a therapist, we call ourselves, anxiety coaches, coping cat coaches, you name it, feelings coaches, because, we don't want kids to feel stigmatized by what is a normal emotion that, again, sometimes runs amok.